Hello, I'm Dr. Frances Pitzilis. Do you have an irritable bowel? Well, it's actually quite common. 1 in 5 people have this condition, and most of them don't even know that they've got it. An irritable bowel is strictly defined as someone having abdominal discomfort with altered bowel function for 3 months or more, and people don't find anything wrong with them. And what most people find is that they get bloating, wind, belching, farting, diarrhea, constipation, acid reflux, and generally bowel discomfort. It tends to occur after a meal, but not always. It can occur in the morning after the meal. Now, what's important about this is that in most cases it can easily be dealt with and treated if you know that you've got the condition. But there's a small caveat. We don't want to miss something serious like bowel cancer. Now, if you do have an irritable bowel and we know that there are no other danger signs, then you can easily treat this by looking mainly at your diet. Look at gluten first, which is in baked foods, bread, cakes, pizza, etc. And then if that's not good enough, experts suggest that you look at milk, yogurt and ice cream. Now, if that's not good enough, you should look at FODMAPs. That's FODMAPs, and it's short for something like fructooligosaccharides and polyols. Now, these are the fermentable sugars that are in some foods that some people are sensitive to, and it causes a lot of wind for them. You can easily look up FODMAPs on the internet and get a good list of foods. Now, aside from that, you can go and see your family doctor and make sure that there's nothing sinister going on. Sometimes people get these symptoms after they've had a bowel infection, and they can go for a little while. Now, most people don't know the exact cause of this condition, but they do know that it's multifactorial. It can be the way the person's made up, it can be stress, it can be their diet, and it's genetic. Sometimes counselling can help, and your doctor can give you various medications to help you with the different symptoms like bloating and diarrhea and pain. Now, importantly, you can use some natural therapy to help you with your irritable bowel. There's been a lot of research on probiotics, the friendly bacteria that help your general health. And a lot of researchers have found that there are various different probiotics that do quite a good job. But there's one in particular that has a lot of success. Now, this is called Lactobacillus plantarum 299V. And that particular probiotic, in my experience, gives a lot of success. So do try that as well. Now, what's important is to make sure that there are no alarm signals to make you worry about the risk of bowel cancer. The alarm signals that may make you concerned include that these symptoms are quite new and you're over 50. Unintentional weight loss, diarrhea during the night, you become iron deficient or you have blood in your stools, and if there's a family history of colon cancer, celiac disease or inflammatory bowel disease. Now, this is when the doctor's more likely to refer you to the gastroenterologist, who's a bowel specialist, who will want to look inside the bowel with a camera scope, and that's called a colonoscopy. So that's very important, and while he's there, the gastroenterologist may want to check for lactose intolerance and celiac disease as well. Celiac disease is an autoimmune disease where you just cannot have any gluten at all. Now, once all of this is checked out, and often people with irritable bowel syndrome have completely normal tests, you can feel reassured, and then you can focus on your diet and your lifestyle. You can look at stress management, and you can look at how you view the world. Now that's because the gut and the mind are connected. So how you view the world becomes quite important.